afternoon. My name is Tiffany, and I'm a registered nurse. Today I'm going to be showing you how to start an IV. An IV is an intravenous catheter, and most of the time in the hospital we use these to give you more fluids or to give you medicine. The medicines through the IV also work quicker and more effectively. Okay, I'm going to show you what all we're going to need. First, we need an IV catheter. This is going to be what is actually going to go in their arm. Next, you need extension tubing. The extension tubing will go on the catheter, and this is what we actually give you the medicine through. We need a saline flush to make sure our IV is working correctly. And then we need an IV start kit. In the IV start kit, we have a drape that you can put under their arm, some tape, an alcohol swab to clean the site before you do it, a dressing to put over your IV once it's done, and some gauze. I also have some extra gauze over here on the side just in case I need it. And then lastly we have a tourniquet. The tourniquet is going to be used to put pressure on the arm to make their veins show. So first I'm going to wrap this around their arm. And you have to put it on there tight to make sure that their veins are going to show. Alright, now that I have that on their arm, I'm going to feel on their arm for what kind of feels spongy, and that'll be where a vein is. Then I'm going to take my alcohol and open it up, and then you have to squeeze these so it'll come out, and then you're going to rub back and forth on the spot that you're going to stick, and you have to let that air dry. While I'm letting that air dry, I'm going to apply my gloves, put this under their arm in case they bleed. And then I'm going to remove my catheter, get a piece of tape, and I tear off a little extra, that way we can use that when we get done. I'm going to put this on the needle so once I get it in, it will stay in place. Okay, I'm going to pull back on their skin, insert the needle, and wait till I see blood come back through the needle. Then you're going to advance the catheter and push this, and it's going to retract the needle. I'm going to hold down on their arm so the bleeding will slow down. Take this off and attach it here. I'm going to fold this tape over to hold it in place while I put the dressing on. You stick that down over their arm to hold it in place. And then I'm going to use our saline flush to make sure that it's working. You can pull back on it and you see the blood come back up through the tube, and then you can just push the saline in. Their arm's not swelling up or anything, and that means you're in the right spot. And that's how you start an IV.